Hello, thank you for joining me today. My name is Roy Walton. I am a PharmD student at the UConn School of Pharmacy, and today I'm presenting on the role of pharmacists in biological defense and emergency response through immunization administration. My faculty mentor for this project is Dr. Marissa Salvo, and if you have any comments, questions, or concerns, you can address them to myself or her, and we will respond as quickly as possible. A foreword here, this presentation was created in December of 2020 and presented at the Henry Palmer CE finale for the School of Pharmacy. Since that time, there has been some changes regarding the COVID-19 situation, particularly our vaccine scheduling and eligibility criteria, which I will discuss when we get to the next slide in this presentation. Starting off, though, I want to discuss the Biomedical Advanced Research and Development Authority, commonly known as Barta. This was established in 2006 by the Pandemic and All Hazards Preparedness Act, and it reports to the Office of the Assistant Secretary for Preparedness and Response, which is within the Department of Health and Human Services. This organization's primary responsibilities are the coordination of our national strategy for defense against bioterrorism, as well as the oversight of our strategic national stockpile, which means the procurement, storage, and distribution of medication and medical supplies in response to emergency situations. Next, I want to discuss the pharmacist's role in these emergency situations, very broadly speaking. Community pharmacists serve as points of distribution and also as public health ambassadors. Our hospital pharmacists may serve as a triage point or responders if there's a mass casualty event in their area. Other licensed pharmacists, pharmacy technicians, or pharmacy interns such as myself may find themselves responding to emergencies through volunteer organizations such as the National Disaster Medical System, the Medical Reserve Corps, or any other organization. There's many of these organizations and they're in desperate need of help, so if you have the time, I implore you to provide them your services. Briefly touching on COVID and what it has done for us as pharmacists, pharmacy technicians, pharmacy interns. It's obviously a real-time situation that is changing on a daily basis, but it has provided broadened authority for us already. We can now screen and test patients for coronavirus. Additionally, we can administer COVID-19 vaccines. There's currently 3 products with emergency use authorization: the Pfizer-BioNTech one, the Moderna, and the Johnson & Johnson product. I assume we'll be getting a 4th soon once AstraZeneca irons out some of the hiccups they've had with thrombolytic events and efficacy data. So I expect that to be coming to market in the next month or so, once they get that all straightened away. But in the meantime, those are the 3 that we're utilizing. Beyond that, we have expanded authority to provide regularly scheduled vaccines to all patients 3 years of age and older. We're also utilizing our in-place logistical network for vaccine distribution. I'll touch on this more once we move to the center flowchart regarding Operation Warp Speed and our current vaccine efforts. Lastly, as I said, you're a public health ambassador. Your job is to educate on risk mitigation and treatment options if someone were exposed to or confirmed to have coronavirus. Moving to the center portion here, you'll see these 2 flowcharts. I'm going to start with the top one. It's very generic, but that's because it's pertinent to any emergency situation. It's a 3-tiered system, and we're going to start at the federal level. This is where Barta, through the Strategic National Stockpile, keeps all of these supplies. From there, it's going to our state level. It's going to come in through ports of entry, which is commonly an airport. It could be an interstate highway as well, but we're seeing with the vaccine product, it's primarily being flown into regional airports. Beyond that, from the Strategic National Stockpile, supplies are also being allocated to state stockpiles, from which they are then distributed to the municipal level through emergency distribution efforts. This is more pertinent to PPE. This is an effort that is still being undertaken. It's been going on since the beginning of this pandemic. This is primarily a state-run effort with our National Guard assets manning these sites, providing PPE to municipal governments and healthcare facilities to ensure they have adequate supplies so they can protect themselves while doing their job. Beyond that, From the port of entry, you're going to see these vaccine products and treatment products being sent to hospitals and pharmacies where they'll then be administered to patients. A couple things to note: the flow of supplies is dictated by realized threat. That just means if there is an increase in coronavirus cases in a certain location, we're obviously going to direct more product to that location. Barta is also utilizing both commercialized and militarized assets to keep this flow going. That just means that based on regional availability or the timeline that they're looking at, they're going to utilize FedEx, UPS, USPS, or they're going to put it on a C-130 and fly it. Whatever's available to them, they have authority to use and they are using. Additionally, McKesson won a bid in 2016 so that they are the primary distributor for pandemic operations. That means you're going to be utilizing that McKesson system you're so familiar with to get vaccine product into your pharmacy. The flowchart below this one is actually from the CDC regarding Operation Warp Speed and the COVID-19 vaccine distribution. You'll see it starts with our manufacturers, and then it's going to our distributor, which is McKesson. From there, they send it to their local depots, where they then send it on to those sites of need that are listed on the right-hand side. I've highlighted in red the ones where pharmacists have the most active roles. The first is obviously the pharmacy. This is our temple. This is where we work. Beyond that, though, there's home health care, other federal sites, as well as public health clinics, mobile vaccination sites, and mass vaccination sites. You're seeing these pop up all over our state already, and pharmacists are doing a lot of good work in all of these places. And I implore you to keep it up, and I implore you to keep pharmacy interns such as myself busy. We're here to help you, and we're here to learn. Looking beyond the COVID situation briefly, I want to discuss other emergency situations where pharmacists have active roles in responding. The first is a Seaburn event. Seaburn stands for chemical, biological, radiological, or nuclear. This is going to be an act of war perpetrated against the United States by either a state or non-state actor. The most common thing that we talk about is things such as sarin gas. These organophosphates, these are weapons, these are chemical agents that are used to cause mass casualty and harm to large population centers. In response to one of these attacks, we are able to administer atropine to those affected to reverse the effects of these organophosphate agents. Additionally, if we see the weaponized use of smallpox or a resurgence of anthrax as a weapon, we can provide vaccinations to prevent people from becoming ill if they are exposed. We have the BioThrax for anthrax, and we have our smallpox vaccines. So if we see one region that suffers an attack with a weaponized agent of this type, we can go on the defensive and start immunizing people so that if they are exposed, there is a reduction in harm. Outside of the Seaburn realm, we have our natural disasters. This is probably the most common thing we see outside of this current pandemic situation. Obviously, in natural disasters, we have a large displaced population. These evacuees are going to be living in close quarters, so our primary concern is communicable disease. For the foreseeable future, we will be immunizing these people or ensuring they're immunized against COVID-19. But beyond that, the CDC recommends providing seasonal influenza vaccines to all of these people unless it's severely contraindicated. Then you're going to assess their immunization record if it's available to you. If not, you're going to look at the ACIP guidelines for that patient's age group and administer any indicated vaccine, because you don't know if they've had it, and you're trying to reduce the possibility of harm in this large population of displaced individuals. Now, moving on to the second slide here, there's not a lot to talk about here. I just wanted to add this. Originally, it was a projected scheduling, right? Now we're working through this schedule. So we've gone through that phase 1A where we were immunizing our healthcare workers, and we're completing that phase 1B with our essential workers, those over 65, and people with significant comorbidities. And we're moving into that phase 2 of our general population. In Connecticut, those over 45 are already eligible, and originally they were planning on an April 9th date for 16 plus being eligible. They've now moved that back to April 1st. So starting April 1st, anybody 16 years of age or older is eligible to schedule an appointment for their COVID vaccination. So in that infographic, we've kind of moved into that second sector. We're looking at this with hindsight, and we see how far we've come, but there's still so much work to do. We have to continue doing what we're doing and expand our effort. Pharmacists are critical to this ongoing COVID vaccine effort, and we're doing great work, and I implore you to keep it up. This presentation is all about our role in response to an emergency, and we are living through one of the greatest emergencies this country has ever seen. So I implore you to educate yourselves and others as it pertains to COVID, but I also implore you to be aware of your role in other emergencies so that if they occur, you can be there and be ready to help. You're vital, and I appreciate the work you're doing. Besides that, I appreciate your time today. Thank you for coming and listening to my presentation. It means a lot to me. As I said, if you have any comments, questions, or concerns, please direct them to myself or Dr. Salvo. Thank you for your time. Enjoy the remainder of your day.